And then we'll have questions and answers. So if you have any questions, unless they're really burning questions, please hold them till the end of that presentation. And then at the end, we'll have a Q&A session for about 10 minutes dedicated to that specific paper. And so we'll have 4 of those back to back. And at the very end, we'll have about 20 minutes left, I hope, if we're on time, to have an open-ended, what we call a panel discussion, but this format we have on Zoom right now, we don't have a panel. So it's going to be authors and readers and you audience members, just an open-ended discussion, and that I'll try to moderate. I'm not sure if Sotos is going to be around. Mark, Sotos, or Tal, if you guys are around and can help me moderate as well. By the way, I'd like to acknowledge the hard work by Alan Wang, who just graduated with his PhD from my lab and is going off to Stanford to do a postdoc. And Alan was sort of the person who came up with doing this event, and he really, with the help of James and OL, he really pulled this all together, and he's going to be sticking around as well. And I'm hoping, Alan, you can help with the panel discussion at the end as well and leading the Q&A. All right, unless there's any questions or concerns that you want to bring up right now, I'm just going to kick it off. And as you might have heard, Alan's recording this, and the purpose of this is to essentially make it available for those of you, for folks who might be interested in this and couldn't really make it. The timing didn't work for them. Okay. And as you know, we're a global community, and it's really sometimes very hard to find the time that works for every part of the world. We try our best, but I think for the West Coast this time it didn't really work out. It's kind of early for them right now. So we'll make the recordings available on our website or through some means. All right, so I'm going to kick it off. And so our first speaker today will be Yunjie Chen, who's coming to us from Leiden University Medical Center in the Netherlands. He's going to be talking about a generative modeling approach to do MRI sequence-to-sequence translation. So if you know a little bit about MRI, there's various ways of collecting MRI data that we call them sequences. And he's using generative modeling to take one sequence and translate it into another sequence. And the title of his talk is Cones, Conditional Neural Fields with Shift Modulation for Multi-Sequence MRI Translation. Yunjie, if you're ready, can you just quickly share your screen and we can confirm that it looks good on our end?
Sure.
Awesome. Yep. If you could make that full screen so we just see the slide.
Sure.
Perfect. That looks great. Take it away.
Okay. Thank you. So, hi, everyone. My name is Yunjie Chen. Now I'm a PhD student from Leiden University Medical Center, supervised by Marius. Today, I'm giving a talk about my research on conditional neural fields with shift modulation for multi-sequence MRI translation. So as we know, multi-MRI modalities, they are very important in radiology and medical image computing. But most of the deep learning models assume all the MRI sequences are always available. However, this is not always true. For example, due to the diversities in image protocols, or maybe the clinical restrictions on the use of contrast agent. So such absence of the MRI images could make the use of deep learning techniques more difficult. For example, if we have trained a deep learning network like a UNet segmentation on the patients with all the modalities, how to deal with the patients with only some of the images. One way to tackle this problem is paired image translation. Given a data set in which all the instances have aligned data from 2 image domains, we can train a neural network that map the 2 image domains, and so that we can get 1 images from the other. So in our case, we want to train an image translation model, translate from one MRI sequence to the other. First, I would like to briefly introduce the idea of conditional near field. Driven from the idea of the field in physics, we can call a neural network that maps coordinates to a quantity as a near field. We can basically model any kind of the quantitatives over space using near fields. For example, gravitational field, or a 3D shape as sign distance function, or maybe an image itself. So all of them can be parameterized, can be represented by a quantity over space, and can be parameterized by neural networks. And initially, the neural fields only takes coordinates as the input, so which means each neural field can only model one instance, one images, one shapes. One extension of neural fields is called conditional neural field, in which we can vary each neural fields via latent code. The latent code can be a vector for each, can be a different single vector for each instance, which is optimized during the training, and it can be also generated by an encoder network, as what we do in our model. So in this study, we apply conditional neural fields to address paired image translation problem. So in the proposed model, we first have MLP, which that takes coordinates as input and output the intensity value of the dark images. So we can also call it coordinate-based network. One trick to better fit to help the network to fit the high-dimensional data is positional encoding. Before we feed the coordinates to the model, we can apply the sinusoid function to the coordinates and map it to the high-dimensional space. And besides the MLP, the model is equipped with an convolutional neural network-based encoder, this encoder will generate the latent codes for each instance, for each patient, that contains the case-specific information. So the model can generate so the network can be conditioned on this latent code, conditioned on the source images. By predicting all the intensity value of the target images, we can finally obtain the entire missing images. And the next problem is how to use the latent code in the MRP. One simple approach is using hypernetwork, which means we can replace all the weights and biases of the MRPs with the latent code. So the latent code can be a very long vectors. That's the number of the parameters of the MRP. But instead of this, what we can do is to keep these bias and weights optimized. They are still trainable parameters, but we can instead adding latent code to each neuron of the MRP as an actual bias. So this is so-called shift modulation. This can because we are shifting each neuron of the MRP. So in this way, we can keep the size of latent code very small. Based on our experiments, we can see that by using shift modulation, we can have a more stable training and a comparable results with much less parameters. And our model was trained by a weighted sum of the following four loss function. We use L1 loss as the reconstruction loss that measures the difference between the synthesized images with the ground truth. We use the cross entropy based adversarial loss to better improve the image quality of the synthesized images. We also introduced the feature matching loss, which is based on L1 loss to help the model to train the discriminator. And lastly, we introduced the latent code regularization to the latent code, which can helps the which can further stabilize the training. Okay, then let's move to the experiment part. We implement the image translation experiments on 2 brain tumor data sets. Both the data sets are rigidly registered and resampled before the training. And to simplify the problems, we select one sequence as the missing target and the rest sequences as the input source images. We evaluated our synthesized images using image similarity metrics, MSE, SSM, and PSNR. We compared our model with 4 state-of-the-art models: pixel-to-pixel model, P-GAN model, which is also a pixel-to-pixel based model, ResFit, transformer-based model, and ASP.NET, which is also a neural fields-based model. We evaluated the results from the whole images, both from the whole images and also the region around the tumor lesion, which is more relevant to the clinic. So as we can see on the slide, our model performed best in all the metrics compared to all these state-of-the-art models. And visually, we can see the proposed model can recover more details, especially in the region around the tumor. So the next problem is how does it work in downstream task? We then evaluate our synthetic images in a tumor segmentation task. In our experiments, we trained a non-neural net with all real MRI sequences, and during the test, we replaced one of the channel with either zero mask or the different synthetic images. Yeah, and as we can see on the slide, by using the synthetic images, or whatever it comes from, the pixel-to-pixel model or the ResVet model or the proposed model, all of them can improve the segmentation performance compared to the zero input, and our model performed the best among all these models. Yeah, and the last question is, why does the neural field methods perform better? We then evaluated the synthetic images in a frequency domain. We first perform a Fourier transform to both the real and the synthetic images. We can see that all the CNN-based models, well, they failed to reconstruct high frequency domain, the age of the 2D Fourier map, while both of the neural field methods, the ASP.NET and the proposed model, can reconstruct better high frequency signals. And to get a better view of the spectrum distribution, we then project the 2D Fourier transform into 1D and aggregate the 1D spectrum distribution over the whole data set. As we can see, again, all the models have a very close distribution in the low frequency domain, while only the 2 neural field model, the ASP.NET and the proposed model, can offer close high frequency spectrum distribution. So yeah, we think this is one of the reasons why using neural field methods can offer better results. So yeah, in conclusion, our experiments show that the conditional neural fields offer an alternative approach for paired MR translation, and our model performs better than all the state-of-the-art methods, both quantitatively and qualitatively. And our spectral analysis shows that the neural fields can reproduce more high-frequency signals compared to the conventional CNN-based models. And our segmentation experiments shows that the paired image translation models can significantly improve the segmentation accuracy, and our proposed model still perform the best. However, our model cannot handle arbitrary missing MRIs. Our experiments only take still can only output one specific MRI sequence. So further work would be adapting the proposed model to random incomplete MRI sequences, which is more close to the clinical setting. Yeah, thanks.
I'm doing the clapping for everyone. Perfect. We're really good on time, and I think we probably have about 10 minutes to discuss this paper. I don't know if you guys ever been to a conference called IPME. It's one of my favorites, and we often have these open-ended discussions at the end of each paper's presentation. So I want to really emulate some of that spirit. I'd like to open this up for questions. So please raise your hand, and I'll call you out, or you can just maybe, if you're not shy, unmute yourself and just speak up. Julian, you've raised your hand. You can go ahead.
Hi, thank you very much for this interesting presentation. So coming more from an MR physics background, I have like kind of a philosophical question. So the reason we are acquiring multiple contrasts during sessions for like tumor imaging, for example, is that each contrast has like specific signature of the underlying microstructure and meaning of the signal. For example, T1 with and without contrast can help to distinguish blood-brain barrier disruption. The T2 would be used for edema, cavity, cystic, and there's also proton density, DWI, and so on. So I guess my question is, given that each contrast has specific signature to pathologies that could differ across individuals, I'm wondering to what extent generating a contrast, doing a contrast translation based on the existing contrast, there is an information missing. The information missing is the one that is coming from the MRI that is actually missing, right?
Yes.
Do you think, I guess, so the reason I pose this as a philosophical question is because, with all those, generative AI approaches, how problematic do you think, generating missing information will be ultimately down the line when these tools will be used for diagnosis purpose, where we want to make sure to do differential diagnosis between two different patients with subtle differences that were not, taken into account during training, for example.
Yeah, I think it's a very nice question. Indeed, I think what machine learning can do is find a potential map between the two sequences. Maybe it can. So I think the generative model cannot create a new information. That's for sure. What we can learn is the mapping between the two sequences. So
let me ask, if I'm hearing Julie correctly, he's probably saying, or my interpretation of what he's saying is, there's not a one-to-one mapping between sequences.
Indeed.
Right. And so how do you account for that? And because your model is going to give me one result, given the input sequence, it's going to give me one result. And how do you, or have you thought about accounting for the uncertainty in that mapping, right? For example.
But the uncertainty model can also not like creating new information, right? So
it won't, but it will tell you whether it's confident about the one-to-one mapping versus where it's uncertain. There might be multiple potential instantiations of the image sequence trying to recreate, right? That correspond to the input image sequence. So because but maybe I can also approach this from a different angle, and I'm no MR physicist, but the underlying signal, there's a finite degrees of freedom for the underlying signal, right? And so, what is it, 3 or 4 free parameters per voxel? Julian, you can correct me, but there's in the MR forward model, there's a handful of parameters that define the forward model, right? And I assume that given enough MR sequences, you can actually reconstruct any potential sequence. It's just the question here is, you've set it up as, you give me one sequence and I'm going to translate it into another sequence, and that's an ill-posed problem because it's under, there's many more parameters that you're not accounted for. So could you, there's 2 potentials here, right? You could extend this to quantify uncertainty in your prediction. You can say, oh, okay, here's my best guess, or here's a bunch of best guesses, and here's uncertainty around those. Or you could say, take as input, you could have multiple sequences as input, and then improve your best guess and reduce that uncertainty, right? You could do them both together. So have you thought about extending in that direction?
Not yet. All what I will do is deterministic, but indeed, its uncertainty is very, indeed, it's a U-post problem, so uncertainty is very suitable, I think. Maybe it's next, can be a next directions.
Fantastic. Yeah, I think this would be a natural next step for
yeah, true. Yeah.
Any other questions? Please don't be shy. I'm sure some of you have worked on this problem. I'm sure some of you have used neural fields or done MR to MR translation. Maybe share your own experience or your own challenges with us.
Berit, can I ask a question?
Yes, go ahead, Sotos.
So thank you so much. Very nice actually work. I have a bit of a question about how do we scale nerves up, right? And what sort of limitations we have with nerves in our field. So it seems that, and I'm not a nerve expert. Actually, I'm not an expert on anything, I think. But how do we go about creating nerves that don't have to be, let's say, tuned and trained for each, let's say, new observations we get, right? What is the progress in the computer vision field, and what sort of limitations we will have to face if we try to port some of these progresses and advances in the medical imaging world? Could the speaker perhaps elaborate?
Sorry, I didn't really follow.
Yeah, it's my way of speaking peripherally. So what I'm saying is that you said before that you have to train one nerve per observation, correct? Like you collect the data and then you create one nerve, right? That's what you said before in the beginning, right?
Yeah, but in our model, we actually train from a data set. It's a population data.
Right, because he has a conditional nerve, right?
No,
yes.
I understand that. But what I was trying to say, there is kind of like a lot of work happening. I was being on purpose vague and on purpose sounding that I didn't know. But what I was trying to say that in computer vision now there is a lot of, let's say, work on this one-shot, zero-shot nerves, right? So, and I was trying to basically get you to connect with these. And how do you see some of their work porting into medical imaging, or they may not be able to be ported in the medical imaging?
Do you mean like a personalization?
So if you were to train from the population the nerve, you will always face the issues of what's happening with generalization, correct?
Yeah.
So what are we, so you, on one extreme, you have basically, given these observations, train a nerve on my data, right? And I have to do this at every time. On the other extreme, I train from a population, correct?
Yeah.
So there must be something in between, right? So my question is, this generalization question it's a general question that exists for all AI, right? But is there something particularly that in nerves that makes generalization easier or makes it harder? Or we should be looking at, let's say, is there any way we can do test time adaptation nerves, et cetera, et cetera, et cetera. So that's what I was trying to guide the discussion, right? Without being too overly specific. Does that help better, Yunjie?
I think, yeah, I think I can, I think I know what you mean. in the performance field, I think the neural fields always perform better than the conditional neural fields. You train a specific model for one patient, you fit this patient, you fit it better. It definitely perform better. But then so I think it's a problem for the so the reason why we seek for a conditional neural fields, which is trained from a population, is we don't really want to run the training for each patient in the clinic.
Of course.
That would make, because I think the idea of machine learning, why we need to introduce machine learning in the clinics, because we want to make our life easier.
Yes.
If we want to train the model for every new patient, then we are not making the life easier. That's my idea why we introduce computation. Make it easier, more accurate.
Of course.
So you can make it more accurate if you train one model for one patient. It works perfect in the training data, but you are not really make the life easier. That's my
Okay.
I think that's my motivation why we use conditional neural fields.
But presumably, right? I mean, like continuing what Mert was asking, and also what Sotos was asking, if you would change this to something where you go from many sequences to many other sequences, then it could presumably, I mean, I don't know if this would be easy to train, but let's say for sake of argument, you can train it. Then presumably if like one sequence is missing on the output side, you could predict it. And then you could sort of like with the ones you actually have, sort of like fine tune your conditional model so that it sort of like adapts very well to what you see. And then maybe this wishful thinking, so like drag the one that you're missing into the right direction.
Mm-hmm.
Yeah, leveraging the fact that you might have multiple sequences per individual and you have a sequence agnostic sort of model that could be used to personalize, right? With minimal computational effort. Like the personalization or the fine tuning would be pretty efficient.
Yeah, that can be an option.
Yeah. Yunguan, you raise your
Hi. So just inspired by the discussion, I'm just wondering, because in this work, the Yunjie is kind of studying, like, I have some sequences, they train the model on some data, you have all the sequences, then you say, okay, I missed something, I try to predict it, then use this kind of model to predict some additional sequences when there's really no such thing. So I wonder, because nowadays, this multimodality, multitasking learning has been so popular. I'm wondering, have you ever thinking about it's part of your training task in addition to something else? So eventually you do not have to predict the missing sequences. It's just during the training, you sometimes got all the sequences, you sometimes doesn't get all the sequences. And then somehow the model learns to leverage on partial informations. It would also be something very similar to this masked language modeling. Well, that's really limited to NLP, but this masked learning where you mask something out, then you ask the model to predict them back. I'm just wondering, because I feel like if eventually we can skip this step of using those sequences, because in the end, when you do the downstream task, you still relies on a UNet that takes that information in. I'm just wondering if there's any source to do an end-to-end thing so that eventually we don't have to predict the modality, the missing modality. So it's just inspired by the talk question.
Yeah, so thanks for the questions. So yeah, indeed, our target is always the downstream task, right? The segmentation, the diagnosis, the classification. So if you get a perfect improvement, perfect performance, it doesn't matter. Honestly, it doesn't matter what kind of fake MRI you get. But my idea is, if we can output a perfect synthetic MRI in the meantime, it can make the model more trustable. So okay, our model can output a looks very nice, very realistic MRI. So that's why our model can improve the segmentation for the missing for the patient with missing images. Yeah, I think that's kind of to make because one of the problem of the machine learning is it's a black box. It's a big concern in the clinics. So I think if we can in the meantime output the missing images, we can make the less black. That's my idea.
Thanks.
Are there any other questions? By the way, I just want to remind you that at the end of the presentations, we'll have an open-ended panel discussion as well. So if you have big sort of picture questions, you can leave those to that as well. If there's no more questions, I'd like to move on to the next speaker. Thank you, Yunjie. You can stop sharing your screen.
Thank you.
So our next presentation is going to be, I assume this is two speakers. So Ravi Hassanaly and Ninon Burgos from Sorbonne in Paris. And they're going to be talking about image reconstruction for anomaly detection in FDG PET imaging. Oh, perfect.
Hello.
Screen already. You guys could take it away. Thank you.
Okay, can you see my screen?
Looks great. Yeah.
Perfect. Thank you. So thank you for inviting me and Ninon. So I will be giving the talk because Ninon is a bit busy this afternoon. But so as you said, I will talk about the evaluation method that we developed in our task of detecting anomalies in a brain FDG PET using deep generative models. And I will explain this in 15-20 minutes as you asked. So I will not go to the basic clinical definition, and I guess most of you know what is Alzheimer's disease, but you must know that it's very important nowadays to detect Alzheimer's disease on the very early stage of the disease, and that nowadays the clinical diagnosis is done using cognitive tests such as MMSE and CDR, meaning that the patient already have the first symptoms. But we know that there are some physiological changes that appears years before the first symptoms that we can observe using medical imaging, so brain imaging. For example, on amyloid PET scan, we can observe the accumulation of protein beta amyloid. On PET scan, we can observe the neurodegeneration of the neurons. Later on Qian weighted MRIs, we can observe the atrophy that can occur caused by Alzheimer's disease. And our goal is to provide a robust tool to analyze brain images for the early detection of Alzheimer's disease. So to build such a tool, you can use deep learning, and the most common way is to train a supervised algorithm. For example, you would train a classifier that would detect between diseased and healthy scans, or a segmentation network that can detect abnormal areas. But it obviously gives really good results, but it will require a lot of time to annotate the images, especially in the segmentation case, when you have to segment 3D images. And this will be very specific to one problem. So for example, if you have images in the context of Alzheimer's disease, if you have some new disease, for example, another rare dementia, such as, I don't know, BVFTD or PCA, or like it can be whatever, the algorithm won't be able to generalize to different diseases. That's why we try to use generative model to learn the normal distribution. That's what we call the unsupervised anomaly detection. And the goal is to learn the healthy population image distribution, and then reconstruct any image, so it can be a healthy image or abnormal image, using this generative model in order to have a pseudo-healthy reconstruction. So the advantage is that it can generalize to any kind of anomalies a priori, and also it doesn't require any voxel level annotation that is very costly and long. So in practice, we have a generative model, and in our training setup, we will train the model with only healthy image. So we have healthy FDG PET scans, and we just give it to the model so it can learn to reconstruct this image. And then when we evaluate the model, or use the model for inference, we use a real image with anomaly, and we give it to the generative model. And since the model can only generate healthy image, we expect the model to generate a model without the anomalies, so a pseudo-healthy version of it. And then by comparing the input and the output of the model, we can see that we expect to observe the anomalies that can be hypometabolism or hyperintensities in the image. And then this can later be used by a clinician to apply his diagnosis and help the patient. So this approach has been obviously, you probably heard of it, obviously applied a lot in the literature, mostly on anatomical MRI. From what we saw, it's mainly for sharp and precise anomalies such as MS lesions, gliomas, stroke lesions, and most of the approach are in 2D, sorry. And usually, even if it's unsupervised, we have we use the dataset. So the researchers use the dataset with annotations such as BRATS, IELTS, ATLAS, you may know, which allow to use common segmentation metrics when you evaluate the model, such as DICE, IUPRC, IU-ROC. In our case, we will apply this to FDG PET. We have smooth anomalies, so the anomalies due to dementia are quite smooth. We use 3D images. Our dataset is non-annotated, sorry, and we can't use standard evaluation metrics. So we use data from ADNI, and just as a preliminary step, we use the Clinica software to register them and do intensity normalization. So in the end, we have a 3D image that is in the MNI space. So our goal is to reconstruct pseudo-healthy FDG PET to detect anomalies in the context of dementia. And we have two main objectives. First, we want to evaluate the quality of the reconstruction. For that, we can commonly use reconstruction metrics, but we also want to make sure that the image that we generate is looking healthy and allows us to detect anomalies. And for that, we don't have ground truth. So the idea is to simulate abnormal image and create pairs of ground truth and diseased image. So this is summarized in this scheme. So you have original FDG PET from your test set that is healthy. You simulate some hypometabolism, so some anomalies. And then when you reconstruct an image using your generative model from the simulated image, which is here, you expect that, so the target of this image will be this one. We don't use it for training, only for testing purpose, but then we can measure some reconstruction metric between these two images to evaluate the second point. And also we can define some other metrics that I will explain. So the simulation pipeline is the following. So we have a healthy subject FDG PET scan, and we have some regions associated with different disease. So for example, here is the mask of the region associated with Alzheimer's disease. We smooth this mask, and then we reduce the intensity. Since FDG PET is an intensity map, we just reduce the intensity of the FDG PET in the region defined by the mask. And we can apply different intensities to simulate different degrees of anomalies. And we can also generalize to any different dementia. So we define here 6 different masks, so AD, BV, STD, PCA, and 3 variants of primary progressive aphasia to have different regions of the brain in order to evaluate in depth our models. So this is our data set in ADNI. We have around 3,500 images from 1,600 subjects. We discard the MCI patients because we don't really want to use them. And then we keep only cognitively normal subjects in our training set, and we keep some of them in our test set, and all the AD patients are in the test set. The split is stratified, and then we later split the train set into validation and train, but I won't go into much detail. We then take the 60 subjects of the 60 cognitively normal subjects from our test set, and we apply the mask at different intensity to build new test sets. We apply also the different mask at 30% hypometabolism to have more test set, which gives in total 14 test sets with the same 60 subjects on which we simulated the different dementia at different intensity. And we also have the original AD test set from ADNI, which make a total of 15 test sets to evaluate our models. So the evaluation procedure can be summarized as follows. So we first measure the reconstruction metrics on image of healthy subjects and their reconstructions. We can then reconstruct, compute reconstruction metrics such as MSE, SSE, and PSNR, as I showed just before, between these two images. So the reconstruction of the simulation with the original image. We also define the healthiness metric that is that uses the information of the mask. So the goal is to compare the intensity in the mask with the intensity outside the mask, and we expect, like for healthy image, that this metric is around 1, and we compute it just inside the reconstructed image that is here. We also define the anomaly score that we compute between these two images, which is just a comparison region-wise of the intensity. And then we can also evaluate our model on real AD patients, which give us a full evaluation procedure that is, we hope, as strict and as possible. So to apply here, and just to give an example, in the article, we use the simple variational autoencoder to evaluate our model. So it's just a succession of 5 convolutional layers, probabilistic latent space, and 5 convolution layer in the decoder. And the loss is here decomposed in 2. So we have a reconstruction term and a regularization term, in the latent space. So first results, I'll just show quickly the reconstruction that we have to have some quantitative results. So these are the reconstruction from cognitively normal subjects. So these are healthy subjects from our test set. And you can see that the reconstruction is quite similar to the input, even though we can see some differences in the difference map, which is due to the model's imperfection and difficulty to reconstruct sharp details. But when we reconstruct, so from this image, we simulate Alzheimer at 30%. So we can see hypometabolism here on, for example, or here. We can see that the pseudo-healthy reconstruction doesn't have these anomalies. And as we can see also in the difference map, we can recognize actually the shape of the mask that we use for the simulation. So it means that probably the model is able to reconstruct the healthy image, but this is just a quantitative analysis. So what we want to do next is to compare the reconstruction metric, so the distance between these two images, so here in blue, which is supposed to be quite constant, and these two images, which is supposed to increase with the intensity that we simulate. So we'll simulate different degree of intensity. And here, this image should be always equal to this one. So this distance should be quite constant. And here, this distance should increase because this image will be more and more abnormal, and this one should remain normal or healthy. And this is what we can observe on this violin plot. So we can see the distance in blue increase, but not as fast as the orange one, which means that even if we simulate really high intensity hypometabolism, the reconstruction of the model will remain quite healthy and close to the original image. To another experiment, so this time we use the healthiness metrics that we defined, we can see that if we increase the intensity of Alzheimer's disease simulation, the ground truth healthiness will remain constant. The healthiness of the simulated image will decrease a lot, which is normal because the operation of simulating an anomaly will decrease the healthiness. But we can see that for every percentage of hypometabolism, the reconstruction have a higher healthiness than the simulation, meaning that the model is able to reconstruct a healthy image. And we can observe that even until 30%, 40% maybe, the healthiness is quite near 1. So the VAE is able to generalize to anomalies of different intensity. So we did the same experiment for the different dementia that we simulated. For example, here you have AD 30, PCA 30, and we also simulated like the 4 others. And we can always observe the same pattern where the simulation has a higher healthiness than the reconstruction. So it means that this generative model can generalize to anomalies of different shape and localization. To go further, the issue of this healthiness metrics, sorry, is that it requires the knowledge of the mask, which cannot generalize to any kind of image. It will remain in this simulation framework. So here we try to generalize this healthiness metric and measure the mean uptake in a region that we define thanks to an atlas. So we can see in blue the mean uptake of original images, in orange the mean uptake of simulated images, and in green the mean uptake in the region of network reconstruction. And we can plot it for all the region that we used in the atlas. And we can observe that in the region that we used to simulate AD30, so hippocampus, parietal lobe, and temporal lobe, the mean uptake in the simulated image is much lower than in the original image. And in the reconstruction, the mean uptake will be higher than the one in the simulated image, so in orange, and closer to the blue box, meaning that we can reconstruct the healthy tissue and recover like the healthy intensity of the image. So this is a mean for all the test set. And the advantage of this method is that it can be generalized to real AD patients, and we can observe similar patterns where in green, the VAE reconstruction has a higher uptake than the AD images that are in blue. Especially here we can see in lateral, in temporal lobe, in parietal lobe as well. And in general, the green box will be at the same level as the red box, which is the normal population. So that's a quite interesting result. So this is a population-wise study, and we can also observe a few real reconstruction from AD patients where we can see that we have some high hypometabolism, for example, here, that appears in thanks to the pseudo-healthy reconstruction. So obviously, these images are really abnormal, so you don't need a neural network, but it's just to show that we can observe clearly some hypometabolism on real images as well. Just the last experiment that we did is that we tried, as we use a VAE, we tried to study a bit the latent space of the VAE since it's supposed to be regularized. So we use a PCA to have a 2D latent representation of the latent space. And here, for example, is the two first components of the train set and the test set of normal subject. We can see that they're in the same part of the space. But if we add the hypometabolic image that we simulate, we have pairs of points that correspond to the same subject. So a same subject, whether the image is abnormal or healthy, so the original image in green, will have, so both images will have a very similar latent representation, meaning that the latent representation is more subject specific than image specific. And if we add all the simulation points, we can observe some kind of trajectories in the latent space, which can be quite interesting, we can imagine. So we did not exploit that. We'll probably do it later, but it's interesting to see that the encoder is able to learn some kind of trajectory depending on the intensity of the simulated anomaly that we use. And also it's interesting to see that all the AD image, or most of them, are in the same region of the latent space than healthy image, explaining why the reconstruction of all these images will look healthy, since the decoder only learned to reconstruct healthy image from this region of the latent space. Just to conclude, not to conclude, but just to finish, we integrated this simulation pipeline and most of the tools that we used to evaluate our generative model in the Clinica DL software. I forgot to put the link, but the software is available on GitHub and anyone can use it. So if you're interested to use it for your research, do not hesitate. The software is developed in our lab. to conclude, so we presented an evaluation framework that we use to overcome the absence of ground truth. We apply it to evaluate a 3D convolutional VAE. And some limitation is that it's not yet complete probably to evaluate like real AD data, because I think it's difficult to evaluate like it will be difficult to evaluate like real AD data if we don't have annotation, but this is already a way. And some perspective is to use this framework to compare different models, a work that we already started because we submitted a benchmark very recently of different VA-based model, and we will use probably this framework to compare other generative models, for example, diffusion models or organs that we are also planning to work on with some other colleagues. So thank you for your intention, and if you have any questions.
Thank you, Ravi. Perfect. Right on time. That was a great presentation. Thanks for that. Okay, again, we're opening this up for questions or comments. I'm sure some of you have worked on anomaly detection or with PET images or with Alzheimer's data. So I'm sure you have some experience in the space. Please share that with us, or if you have any questions or thoughts, you can raise your hand or you can just unmute yourselves.
Hi, I have a question.
Sure, go ahead,
Can you
Mark.
hear me? Hi, so my question is, did you compare your method, your variation autoencoder with others? Because I worked and I read a lot of papers about adding tumors or anyway artifact effects to brain tumors using the SPADE, for example. So from the latent space, adding some segmentation maps where the tumors is located to generate a new volume, a synthetic volume with a synthetic tumor.
I'm not sure I understood the question very well. Maybe can you rephrase it?
If you have compared your experiment that you are try to generate synthetic data with some anomalies in the brain with the SPADE, for example, method.
No, we did not compare our method our method to generate synthetic data, since it's not really a deep learning approach. Like we just reduce the intensity of the. Sorry, I need to go back maybe to first slides.
But you used a variational autoencoder to generate or to regenerate a synthetic healthy tumor, right?
Yes, we use the VAE to generate the healthy version of the image. So
yes.
Yes.
And my question is, since guns are better and the SPADE using a gun, why you chose to use a variational autoencoder rather than a gun?
Well, we first worked on VAE for simplicity's sake, because the training is quite stable, especially when you have 3D data. We know that GANs or even diffusion model, they are more difficult to train. And also, we knew that at the end, we wanted also to exploit like the fact that we have a coherent latent space, as I showed with the last plot. We also did some other experiment that I did not present here because I did not have time, but we compared in the latent space like many distances. So we thought it would be a real advantage to use a VA here. And also like mainly like the purpose of this work was not to present a new generative model approach. We really used the most simple one because the goal was more to see if the evaluation method that we developed allows to have a rigorous evaluation of our model. And as I said, like using other generative model would rather be a next step and we already started to work on it. So first we compared like different VAEs approach, and now we are also working on GANs and different GANs approach with some other colleagues in order to see indeed if we can improve the reconstruction quality, because you probably saw here, like the reconstruction quality of the VAE is quite low, and it's something that we are aware of, but for the moment it was more like using a simple model just to see already with that if we can have a nice evaluation procedure. Yes.
Okay, thank you.
Cool. Any other questions? I actually have one.
So,
oh, sorry. Go ahead, Durgesh. I didn't want to interrupt.
okay. So it's a great work. Actually, can you explain here like a couple of questions I do have? One is like in simulation framework, you are putting up like MRI image. So have you used these T1 or T2 images as for using for AD mask? And also, what is the reason of you using only FDG PET, not the A-beta amyloid PET? Because amyloid PET is more popular in Alzheimer's disease. So could you comment on these two questions?
Yes. So maybe I was not clear, but in the simulation framework, we use only the mask that I define here in red. I just put like the MNI template in background for visualization, so we can visualize where is the mask in the brain. But we just use the information of the mask that is defined here in red, and then we use this information to reduce the intensity in the region associated, since the FDG PET has been registered in the MNI space. The same mask can be used. So we don't use here the T1. And for the second question, why we don't use T1
Amyloid PET, yeah.
PET? Mainly because of data availability, yes. So in the ANI dataset, we have a set of FDG PET. We have a MRI that is associated, but which is not acquired with the same machine. So we just use the FDG PET. And also because it's probably more general to study only FDG PET, knowing that not all the FDG PET machine are PET MRI, you know, so there are some PET scans that are only PET scans. So if we can develop a method that is only for PET scan, it would be more generalizable than FDG PET MRI.
All right, thank you.
Any other questions? I have actually one question that I was hoping to ask. I know you showed the PCA space projections of the latent or so-called embedding vector, and you show that they're quite similar between the sort of the healthy version and the simulated disease version. But this could potentially be deceiving, looking at like just two principal components. I'm not sure if it does any justice. And because you actually use the variational autoencoder, which has this probabilistic embedding space, I was actually curious why, I mean, or did you maybe look at the sort of the distances in the embedding space directly? Because they have a probabilistic interpretation, right? You have a prior, a Gaussian prior on that. To quantify abnormality instead of looking at it in reconstruction space.
So yeah, so that's a good remark. Indeed, like using only two components of the PCA is not enough, and even if I don't have the exact number, but I think it just explained like 20 or 25% of the variance.
Yeah.
So it's very low.
Which is also, by the way, not surprising because you have this IID Gaussian prior. So you're actually trying to spread the distribution across all the dimensions equally.
Yes. Yes. Exactly. But so our initial goal was really to use like the pseudo-healthy reconstruction in order to detect anomaly. The latent analysis just came later, and indeed there are a lot of approaches that use directly the latent space in order to find out of distribution images and classify them as abnormal scans. And actually, it was quite interesting because when we tried to observe the latent space, we had at the beginning of our experiment a lot of out of distribution points, and we were quite surprised because even in the train set, sorry, a normal scan, there were some out of distribution points, and we later realized that these images were indeed out of distribution, not because they were abnormal, but because they were not well registered. So there was an issue in the registration pipeline. So indeed, just to show that it can be used to detect abnormal images, but not abnormal because they are diseased. And I think here in FDG PET, the thing is that the structure of the image is not different enough. So for example, probably if you work with tumor or big MS lesions, like the structure of the image will be quite different, which will lead to some out of distribution latent representation. But here it's just an intensity change in some small regions of the brain, which explain why all the abnormal image, whether they are simulated as we can see here or real as we can see here, will be in a very similar latent space area. And as I said, we conducted other experiments, and we can really see, if I can just see, for example, that all the scan for a same subject will be really close in the latent space compared to the closest scan of other subjects, even if they are diseased or simulated. So it really
Yeah, I mean, you could, okay, so in terms of this distance, you could be close, but you could be still far away from the healthy distribution. You know what I mean? Like, because if you look at a multivariate Gaussian, you're concentrating your distribution on the shell, on this hypersphere. And if you look at things on the hypersphere, you could imagine that an unhealthy scan could be a little off of that hypersphere. So if you look at the distances in that way, you're far away from healthy, but you're still close to your own corresponding healthy version. You know what I mean?
Yeah, I think I see. So we did not check that actually. So we did not use the fact that the latent space is Gaussian and use like some probabilistic distances. We just use like simple Euclidean distances.
And that's what I was, I guess, trying to get to. Both PCA and the Euclidean distance analysis is going to be flawed, I think, when you might give you a misleading perspective. And so I would encourage you to think about sort of distances in this distribution space.
Yeah, that's a good point, I think.
Anyway, sorry, in the interest of time,
yes.
We'll move on to the next speaker. So if you could stop sharing, that was amazing. Thank you, Ravi. So we are going to move on to the next talk. Again, if you've just joined, we've just completed 2 presentations. We have 2 more to go. Each one of these will be about 30 minutes. 20-minute presentation, around 10 minutes for questions or a discussion. That's sort of where we encourage everyone to engage and ask their questions or comment. And then at the end, we'll have about a 20-30 minute open-ended discussion, joint discussion period. So our next speaker is going to be Imraj Singh from the University College London. Many of you probably are aware that score-based methods have been very popular over the last few years. And Imraj and his colleagues have worked on using score-based methods or score-based generative models, more specifically, to solve the PET image reconstruction problem. So we're still sticking with PET data, and Imraj is going to talk about using score-based methods to solve the reconstruction problem. Imraj, if you could share your screen, perfect. It's coming up. It looks great. Take it away. Thank you.
Awesome. Thank you very much for the introduction. So today I'll be talking about score-based generative models for PET image reconstruction. And this is work with Alex and Ricardo as well, and the rest of my collaborators. And I'm a final year PhD student supervised by Simon and Chris and Bangti. So very quickly, I'll first go over some basics in PET image reconstruction, then some score-based diffusion. I know we said score-based generative models, but all these things are very related and sort of synonymous. and then applications to PET, and then PET MR imaging, and then scaling to 3D PET reconstruction. So PET is positron emission tomography, and the idea is we're injecting a radio tracer. The tracer radioactively decays, producing a positron. This annihilates with an electron and produces two coincident photons, and these photons are what are detected as a line of response. So we collect millions and millions of these, and then from these measurements, which we denote as Y delta, we are able to reconstruct our image X. So this is the inverse problem background. So we say that our Y is strictly sampled from some Poisson distribution, and we model our forward model as A and B, where B is some estimate of our background, randoms and scatter, and A includes your sort of taking those line integrals and reproducing your image again, or the opposite of that, sorry. And then the challenge here is that we have really low photon counts and really high noise, along with some other issues. But that's the main one we're sort of interested in when we're formulating this at the moment. So more classically, I guess a major method people use in literature is maximum a posteriori reconstruction, where you're trying to maximize some objective function, which includes a likelihood and a regularizer, or prior. And in the case of PET, this is specifically Poisson log likelihood. And in our work, we use BSREM, which is block sequential regularized expectation maximization, which is an accelerated way of doing this, which takes subsets of your data Y and your operator, which is that A and B from before, and you subset it so you can accelerate the algorithm. And there's some convergent guarantees under mild assumptions. And the for a regularizer, very PET specific is the relative difference prior, which is tunable, has a tunable edge preserving parameter. So now taking that previous map reconstruction, so you can view it from a statistical viewpoint. So we have our inverse problem, which you state here. So Y is our sample, or is our data sampled from Poisson distribution. And then also we have X now, which is from some prior distribution we're interested in. So from Bayes' theorem, you can see that the posterior here is the prior times the likelihood, and then the gradient log posterior would be the gradient log prior plus the gradient log likelihood. And then the likelihood here again is the Poisson log likelihood. And the idea in this work is to use a generative model to learn a prior. And for this, we're using a score-based diffusion model. And I think people have the general idea of what a diffusion model is, but it's this idea that you have a diffusion going forward in time. So you start at some initial distribution, for example, your space of all your possible PET images, for example, and then defined by empirical data set, well, that's empirical distribution, and then that goes towards a terminal distribution, which is noise. And for this SDE, there exists a reverse SDE of this form, which goes backwards in time. So it would be a very bad generative model if we were just going from our PET image to noise, so we want to reverse that. And for that, we use this, which is the score. And this is where the score model comes in. So we train a score model so it approximates this score. And we then run this reverse diffusion process backwards in time to get samples at our initial distribution, which is our prior distribution. So we do this by sampling a random image, for example, so complete noise, and then we simulate the reverse SDE with our score model. And there's deep connections with denoising, so you can think of this is the transition density, what takes you from every single sample of your prior distribution up to your noisy image at time t. And you can see that is just a scaled image defining the mean, and then some variance defined by some schedule as well. And then we can see that when we're wanting the expectation of x naught given some xt, that's just applying our score model. So this is the approximated version of what's really happening. So we have a score model here, which is added to our XT, and we get some denoised version of that. So you can think of a score model as many one-step denoisers where we have this additional conditioning on T, which is time, which is done through the architecture, which is a bit outside the scope of this. But essentially, we have a UNet now which can take a noisy image and give you the noise which was added to that image to denoise that noisy image. That's a bit of a mouthful. Okay, so now we have a way of generating images from that prior distribution. We now want to condition that reverse history on some measurements. So we have a time-dependent posterior now instead of just a log time-dependent log density. Oh, great, yeah. And this factors into our score model, and then this thing, which is a time-dependent likelihood. And now the question is, how do we approximate this time-dependent likelihood? And in literature, there's a couple ways of doing this. So one way is sort of an annealed likelihood, where we have some lambda t parameter, which we define to, for example, when we're close to noise, we don't want very much likelihood. We don't care if it's too close to the measurement. So our lambda t would be small. And then as you get towards your denoised images close to t equals 0, you want to have more and more likelihood. And then another approach is very popular, which is diffusion posterior sampling, where we take the Berit gradient instead of with regards to xt, we take it with regards to the Tweedy estimate, or this denoise x naught. And this has an added computational burden of having to back propagate through our network back to xt. So that's two ways of adding in conditioning based on our measurements now. And then, yeah, another way of doing this is to consider the fact that at every step we can get a denoised estimate, and then there's very efficient ways of going from a denoised estimate and putting it back on a noisy manifold. And this can be more efficiently bring you through the different noisy time steps. And this accelerates things and is called denoising diffusion implicit models. So during this denoising step and then adding noise back, when you're at the denoise step, you can then ensure that this estimate is consistent or somewhat consistent with your measurements, where you have some anchoring term. You want to do some gradient descent, for example, on ensuring this is not Poisson likelihood, log likelihood, my apologies, but this is, you want to anchor a term which is close to your measurements in this case. You want to ensure that's consistent with your measurements, but then you also want to anchor it to your denoised image from your score model. And this has been done in literature as well, where in DDS, they use conjugate gradient steps, and then in another method, they use just a single step. And so why did I have the Gaussian approximation here is that when you're dealing with PET reconstruction, it's really important that you use a Poisson log likelihood, because if you don't use a Poisson log likelihood, you can start to see odd things like this. So this is a misspecified likelihood given the underlying noise model, which the measurements are sampled from. So if you have the wrong likelihood, then you get the wrong images back. So it's really important that we have this Poisson log likelihood. And another constraint is that this Poisson log likelihood needs non-negative images x. So to cope with that, we propose an algorithm which similar to the previous ones. So we use DDIM. So we get a denoise estimate, then we ensure some data consistency with a Poisson log likelihood now, and have some anchoring term. And we should note that we do not run this to convergence as well. We just want it to be moderately close to our likelihood term. And then we add noise back in. And the benefit of this is that it takes a lot less steps and steps of your data consistency, and a lot less time steps as well. So it's rather fast. And now to our experiments. So this is all in silico. So we have 30 3D volumes, and we train on 5,000 slices and test on 20 slices. And then we have, for noise levels, we have 2.5 and 10 mean photons per bin. And we should note that the training is all done without lesions, and we test with lesions as well. And we evaluate with metrics of PSNR, SSIM, and some others, which we won't go through in this talk. And then we also assess the lesion detectability with a contrast recovery coefficient, which just makes sure that we're recovering this lesion correctly as compared to the ground truth. So now looking at some results for a mean photon count of 2.5. So on the left is our ground truth. On here is the sort of classical reconstruction with the maximum made per story RDP regularizer. And then we have our annealed likelihood. And then we have our DPS, and then our final method, the DDS. And you can see that DPS from the PSNR outperforms most of them, to be honest. Yeah, it outperforms everything apart from RDP, and PSNR is biased towards more blurry images, so that could be a reason for PSNR outcompeting for map RDP. And then in terms of SSIM, we see that DPS is improving SSIM dramatically, but perhaps the most clinically relevant metric is CRC, which is our contrast recovery, how well we're getting this lesion back, and we can see that DDS is able to produce the best results for that. So there is this sort of trade-off with how we're introducing data consistency, and then also what metrics we're biasing towards as well. And we some more results are that for some optimized values for the score-based generative models, we can see that DDS is performing the best on CRC, and we can also see the sampling time is a lot lower for DDS compared to DPS and an annealed likelihood. And this difference between this annealed likelihood and this PET DPS is that fact you have to back propagate through your score model when you're computing from a 2D estimate. And we also compared versus unrolled dystrophic method, learn from dual, and a post-processing method. So in addition to the just on PET images or PET measurements, I should say, we also looked at additional anatomical guidance from an MR image. And we did this by using classifier-free guidance. So instead of our prior just being of our PET image distribution, we now condition our prior based on some MR measurements. And we include that score term in all the previous sampling methods. So it's you can drop that in as the score in our previous sampling methods. And we can see that as we increase our amount of guidance, we increase our PSNR and increase SSIM, and then also in the case with lesions. But as you can see, when we have the lowest amount of guidance, where lowering the W weight increases the guidance, you can see that the CRC is actually best when we don't have very much MR guidance. And this is because our MRI images actually don't have any information about where the lesion is. So here there's a lesion simulated in the brain, and that's not in the guidance image. So we have this very misspecified guidance information, which is quite interesting because that, depending on then how you use that guidance information, you can decide how much of the guidance to use, so that W weight, sorry. Okay, and then our final thing we looked at is the fact that a score model is typically only trained slice by slice. So on 2D slices, it's typically really computationally expensive to train a full 3D model. So a few methods have been proposed to how to use our TD score model on 3D slices, on 3D volume, sorry. So again, we use our DDS, PET DDS sampler. And so we denoise, and then we apply some data consistency, but we also have some anchoring term And we have some additional regularization in our axial direction to ensure consistency between samples. And then we resample back to our noisy manifold. And to speed up this approach as well. So we try to, this first part is trying to deal with the fact that it's only 2D. And then we want to speed this up as well, because taking a full data consistency update is very costly in PET because the forward operator is quite expensive. So we typically, in a similar way with block sequential regularized expectation maximization, where you use blocks, we try and use blocks again. So we subset our measurements and update on subsets of measurements. So we can see that the reconstruction time when we're subsetting the number of measurements is decreasing, and we can get up down to 2.8 minutes. But obviously there's a trade-off there. So because we're only using a subset of measurements, the reconstruction quality decreases because our likelihood is only based on a subset of the measurements at each update now. And looking at some reconstructions in fully 3D, we can see that the reference image is on the left, and so the classical relative difference prior reconstructions here, and you can see it's quite blurry. And then we also tried the deep image prior with some additional RDP to help cope with the early stopping issue. And it gives slightly better results than RDP, but it still doesn't perform very well. And then for our proposed method, PET DDS, we can see that it works very nicely in plane. But then out of plane, you see these random sort of dots and lack of consistency in the axial direction. And that's where when we added our RDP in the Z direction, that sort of overcame that. And we were able to get better reconstructions and sharper reconstructions and increase our quality metrics. And so in conclusion, we really like this idea of separating out the image modeling from the forward modeling for inverse problems, and it sort of aids generalizability. This idea that hopefully we could use the same model and go to a new scanner with a slightly different forward operator, but the same underlying PET images, and then use it there. And also there's some tuning flexibility in the fact that we always have a regularization parameter we can tune. So we can choose to have more or less data fidelity. Or data consistency, I should say, sorry. And then we also saw that different conditioning methods, so different ways of introducing our data consistency biased slightly towards different quality metrics. So if we used DPS, we saw that we got better SSIMs and slightly better PSNRs, but we didn't necessarily get that local benefits in the lesion detectability of CRC. And then there's some questions to how to deal with hallucinations. And then also all these sampling methods rely on a really strong approximation of this noisy likelihood. And are we really sampling from the correct prior? And there's also some questions how to deal with how to better deal with scaling to 3D data, because ideally we'd have a score model based on fully 3D data. Yeah. And that concludes it. Thank you for listening.
Thank you, Yunjie. That was extremely impressive, and you did a good job in squeezing it all into 20 minutes or so. I'm not sure if there's any questions. I have a couple really high-level clarification questions, because I'm sure many folks in the audience are not extremely familiar with score-based methods, and there was a lot that you had to cover. So in my mind, at least, there's a few sort of things that are not clear. I could ask those, and they're really high level questions. So the first question I had was, can you, so you have this final sort of algorithm, I guess, for reconstruction. Can you instantiate that in terms of what does it look like for during training? What are we training in terms of the neural network? What are the inputs? What are the outputs? And at inference time, what do we have as well? What does that look like?
Sorry, that's my bad for not. So at training time, we're just training on images. So this is like an unsupervised model. I always feel it's a bit weird to call it unsupervised because there is training data, but there's no labels. So we just have our ground truth images.
So we have 2D slices in the 2D case, or I guess you started out with 2D and then extended to 3D, but like you basically have these observed images themselves that are given to you during training so you have the measurements or you have the PET reconstructions or both?
So we only have 2D slices so when we're training to approximate the prior distribution, which is just our clean PET images.
Okay.
So we're training an unconditional score model to sample from that unconditional score model PET images. So all we need is the ground truth PET images. That does pose questions as to, like, in clinical practice, you have never got access to ground truth images. So for a surrogate for that, you could probably use very high quality PET images if you have that, and then use that high quality sort of PET image manifold to then regularize your low count data or low count reconstruction.
And the thing that you're training during training, I guess, what's the input and what's the output of that model?
So for the unconditional score model, yeah, I should have put the denoising score matching loss here, but it's essentially we add some noise. So this is a transition density so this will give us our XT at any noisy time step. So we take a sample from a distribution or image distribution of clean images. We treat that as the mean and add some noise to it, and then learn a model what takes us from our noisy image back to our X naught, which should be this actually. Yeah.
So is time index an input?
Yeah.
Right. So time is an input, and the noisy corrupted image is another input, and the output is the denoised original image. Correct?
Is the gradient of the is this gradient? So it's noise. It's the noise which you've added to the image effectively.
Okay.
I can't remember.
Yeah,
I can't remember if it's
which you can subtract from the image to get the original denoised.
Exactly, and that's what we're doing here. So if you want the expectation, you take the noisy image and then you scale your score model somehow and also divide it by something, and that gives you a denoised image.
How do you sorry, can you remind us, how do you think of the score function as noise? And here I actually, my other question was, can we take a moment to parse this math a little? We didn't spend a lot of time on this slide, but it feels like it's loaded and there's some important ingredients here that I would like everyone to take away something from. How do you think of the score function in terms of as noise?
Well, there's different parameterizations as well. So you can this is denoising score matching, but you can also if you parameterize it slightly differently, I like to think you can also parameterize it as you mentioned, the thing what takes an XT in and a time input and just gives you that denoised image. So you could parameterize it like that. And then you could also parameterize it slightly differently, which I can't remember off the top of my head, but there's epsilon matching as well, which is a slightly different parameterization of this. But it's this idea that you're trying to learn a network instead of mapping to clean images. You're trying to map, or well, you could map to clean images.
Okay, actually, I have it finally. I'm sorry, I'm hogging this, but my final question was, once we train a model like this, right? How do we then use it in the reconstruction? That piece is missing for me. How do we take this model and then use it in reconstruction? Because in reconstruction, we now have a bunch of Ys, right? You give me measurements, and then how do I go from the measurements to a reconstruction using that model I just trained?
So at that point, you have to approximate this thing, which is a noisy likelihood or time-dependent likelihood. So while you're sampling this reverse SDE, you resample it with Lagrangian dynamics. And then
so S theta, the first model was trained, right? That was trained. You've got that already. That was Now you've got to figure out the second term.
So this is the gradient of your Poisson negative log likelihood.
Okay, and that is you need to know the forward model.
Yep.
Okay. And
So
you need to figure out the approximation of that gradient.
yeah, for that time step.
I see.
Yeah.
And what I don't understand in the naive version is why oh, you've gotten rid of the sub t on the left-hand side and you just made it a scaling. P sub t has become a universal constant. Is that why it's an approximation?
Yeah. It's the fact that we don't ever have access to the likelihood at a time t. We just approximate it by the actual likelihood at time. We only have the likelihood for when there's no noise in it. So we only have it for when t equals 0, effectively. So we have to approximate it at t equals 1, t equals big T. And we do that by using this lambda term, which penalizes this likelihood more when you're closer to the noisy manifold and less when you get closer to the denoised manifold. So you're introducing this likelihood term more and more as you get to your denoised. It's very handcrafted, this one, and that's why we call it naive. Yeah.
I see. Thank you. That helps me digest some of this. I hope it helps everyone else. Any other questions? I'm sure some of you have done score functions, worked with score functions, or PET reconstruction. Don't be shy, please unmute yourselves or raise your hand, or you can type and I can read.
Thanks, Imraj. So you referred to methods for sampling. The images, the reconstructed images that you showed, were they single sample or were they posterior mean? What were they?
They were posterior mean. So no, sorry. They're a single sample, my bad. So one thing we're quite interested in, sorry, I should stop clicking through stuff, but I'll quickly bring up this. So here we have our guided reconstruction, and I guess an interesting thing would be to do is to get an idea of your posterior by taking many samples, and hopefully you would see that the guidance would show that there's more error close to where the lesion is because we have trained on a clean manifold and we're sampling on a lesion image. So yeah.
Thank you very much. Nice talk.
Thanks.
All right. Any other questions? Again, just as a reminder, after the next talk, which is our final talk, we'll have a discussion period where if you have any burning questions or high-level comments, you're free to bring up. If we're good, oh, there's one question by Andrew. He says, any work on real data?
No, not yet. This is my big yeah, I'm very embarrassed to say I haven't done any work on real data, which
that's okay. We start with simulations and
yeah.
all that.
So
what would real data mean for you? What would that entail? Actually collecting data?
Yeah, and like the point we made before about the fact that we don't have ground truth data, so we'd have to take some high count data and maybe simulate lower count data. But all our projectors, like we use a software called Surf, and that should be able to cope with real data. So everything's kind of in place to use real data, but we have not gotten around to it yet. So, well, I'm finishing off at the moment, so I don't know.
Someone else has to pick it up, I guess.
Yeah.
Okay.
Thank you.
I think we'll move on. Thank you, Imraj. All right. So next up, we have Youngwon Fu from again University College London, who is gonna be talking to us about diffusion denoising models, like before, but now for the specific task of medical image segmentation. Yung Fong, are you going to be able to share your screen? Let's see.
Yes, I'm trying to figure out the screen. Oh, sorry, I need to grant the app access. I will be back.
No worries. Where's it?
sorry, apologize.
No worries. Maybe could you turn, yeah, here we turn on your camera and share your screen? That would be awesome.
Yes.
All right, there we can see the screen, although, okay.
Yeah, 1 second. Sorry, apologize. Not very familiar with Zoom. Here you are. So, yeah, thanks.
Could you make it full screen so that we just see the slide? If that's possible.
You mean hide the sidebar?
Yeah.
Would you be okay?
It's not a big deal if it's not possible. No
Okay,
worries.
sorry. Yeah, so thanks a lot for organizing the symposium. So today I will talk about our work using diffusion denoising models, but specific for image segmentation tasks. And this talk is not really specific to any particular data set. It's more about a methodology thinking, and also therefore I will try to cover go through again a little bit about the diffusion denoising models, and hope with some visualization can also give us a sense like how this is done from another point of view, and also how it can be applied to image segmentation. So first, it's denoising diffusion model. So the task is to do denoising. So for diffusion model, what happens is that you start with the image, and you have from the right-hand side to the left-hand side, you can see there is this noising process, or we call it forward process. It's like you start with the image, you gradually add Gaussian noise on top of that, and this Gaussian distribution or this transition is defined here so that at every time point, you have the image. Then you wait it a little bit, then add some Gaussian noise. So after enough step of it, the image will be fully noised on the left-hand side. So this is predefined, given, and it's a noise process. Then what we want to learn is the inverse process, is to say, if I have a fully noised image, can I somehow denoise it a little bit so that I can gradually recover a noise-free data sample? In this case, a lovely cat. And so this is the denoising process that we would like to use machine learning or deep learning to learn. And also have to emphasize here, everything are Gaussian, and later we will see why Gaussian is lovely. So this is denoising diffusion models to say the task is very simple. I will be given something noisy, and my task is to denoise it. So what is the model's output? In this case, it can, in the previous talk, the author mentioned that the model predicts the gradient or the noise. But actually, there are also another option. You can just directly predict the noise-free data. Is given any sort of image with different noise level, I always try to predict the noise-free data. So there are two different settings. Then why we want to use denoising diffusion models and why they can be generative, right? It's like I'm just doing denoising, that given any neural network give the same input, I always get the same output, apart from dropout and any other this augmentation thing. So the reason diffusion models can be generative is that when you start the denoising process, the starting point x big T, the noise can be sampled differently. So if I sample different noise, then I can sample different cats in this case. So this is why we want to use denoising diffusion models as a generative models. And then you may wonder, is like, okay, earlier you say that the noising process is to noise the image progressively. It's like you add noise little by little, little by little. Then if I want to have a half noise image, then I have to repeat this process 100 times to 200 times. It will be very expensive, right? Time consuming. So that's why earlier I emphasized that we assume everything are Gaussian, because Gaussian is closed under convolution. So what does that mean? Is like you have something following the Gaussian distribution x0, you add some Gaussian noise on that, the resulted weighted sum will still follow a Gaussian distribution. And thanks to this characteristic here, there is a closed form of the distribution of xt for any time point t starting with x0, which means that for diffusion model training, I can always sample a time t, then given a noise-free data x0, I will be able to sample a noise data xt at time point t directly without really going through this progressive process. So a short takeaway is just like, because it's Gaussian, there are nice characteristics here. So we can sample a noise or partially noise image or data at any time point t as we want. And all we need is a noise-free, clean data sample. So this is denoising diffusion models in a nutshell. Then, okay, today we are here to talk about image segmentation. So image segmentation is quite obvious. Like, I have an image, I want to segment the regions of interest. Why we want to study the generative models, right? Why we want to generate different things? So first is that we may be aware it's a bit different from nature image. There is a human, there is a car. The contour is more or less well-defined. But when it comes to medical image, say, this is a lesion, this is a tumor, sometimes from the image itself, the boundary is not very clear. And depending on the different annotators, you may have different segmentation masks. So, which means that if the model can generate different masks, it may tell us a little bit on this image, what is something we are not sure about? What are the boundaries that we are not very certain? So that's why we are interested in studying generative models. But also more often, moreover, is like when we talk about generative models, this inference, diffusion model inference, it takes multiple time. And earlier we also mentioned, how do we do the inference using diffusion model? It's very simple. You take a noise, pure noise, you do one denoising step, then you do one more denoising step. You do multiple of this time. So the model it's not a one inference and say job is done. You have multiple inference forward process. So we are also wondering, given this more opportunity to predict something, would a generative model be able to provide something higher quality after multiple iterations? So this is the first question, why we are interested in generative model for segmentations. Then also, when we talk to image segmentation, we talk about this. I assume at this point, the very straightforward answer would be, here the label data, Chen a unit. That's it. That will be your baseline. And there are many different methods here. But first question is like, all these diffusion denoising models, can they really do better than unit? And this is something we are also interested in considering. And also in our studies, we try to limit a lot. We try to use the same architecture, nothing specific. And later I will explain our findings. So this is why we are motivated to study diffusion models for segmentation. Then the question is, how can we apply diffusion models for segmentation, right? Because earlier we were talking about Gaussian noise, but segmentation masks are categorical, right? They are class 1 to 3, and it's not continuous. There are multiple different ways. Later we will also mention, but in this work, what we do is like, okay, there are different multiple classes, and we just create a one-hot encoding, and then put the values into -1 and 1. So it's just -1 or 1. Then we relax this value to say, now you can be in any values in the real space. So you do a linear interpolation between the segmentation mask and the sampled Gaussian noise. So the value will become -0.5, 0.7, something like that. And then how we do the segmentation. So normally segmentation model takes one image as input, and that's it. And when we use diffusion denoising model for that, our setting follows the previous work is you take the image, and in addition, you take a noise segmentation mask. And combining them together, we are here tasked to predict the ground truth segmentation mask. So it's worth mentioning that the work we presented and accepted at the MELBA is an extension of a previous work accepted at the MICAI workshop. And in our previous work, we show that we compare different settings of using diffusion denoising models for image segmentation. And we kind of, the two most important takeaway is first, earlier I mentioned, when you use diffusion models, you can predict the noise or you can predict the ground truth data. And we show that in segmentation mask, it's better to predict the segmentation mask instead of predicting the noise. And this is also a trend picking up by the follow-up work that we see, for instance, this MEDSecDiff version 2. And also because you are predicting the segmentation mask, you are able to apply dice loss on it, and instead of the L2 loss or MSE loss. So these two are part of our takeaway from the previous study, and in this work, we just take them as granted. But I think it's worth mentioning that there are some potentially inspiration for potential other work. So this is how we apply diffusion to image segmentation. You know the mask and then you predict them back, but all happen in a real space and where the mask become a multi-channel representations. So what's the issue, right? And what are the problem? And here is the illustration. And earlier I said, you have the ground truth mask, you noise them a little bit. And as you can see here, you still see the shapes, right? You still see, okay, there is this organ here, there's different things. Even we say we added some noise, this shape information, they're still there. So this is what we found in the current setting is that in this task, if you just add noise like this, relatively brutal, it doesn't really noise a lot and you will lose this shape information unless you put a lot of noise. So this means that when we train the diffusion models, the model's input taking this noise ground truth, this somehow contains your target in your input. So there is this data leakage risk here. It means that you are trying to predict the ground truth, but part of the information is given to your input. Therefore, the model is kind of having this, skip link is kind of having this information in advance. So first, it's a data leakage, and later, in another point of view, there's also a discrepancy between the training and the inference. So on the left-hand side is the training. We have a ground truth mask. We noise them a little bit. Then we give them to the model. We task the model to predict the mask. Then we calculate the loss. So what earlier I said is that the noise mask have some data leakage information. And when you do the inference, what you do is you take a noise mask, you put into the model, and you predict a ground truth mask, right? And you do this multiple times. So, but at the very, very beginning, the noise mask is a randomly sampled noise. So which means that during inference, you have never access of the ground truth mask. So during training, all your input is noise ground truth. So there is certain distribution lying behind. But during inference, all your input is noise predictions. So it's a slightly different distribution. So the model's input distribution is not necessarily aligned. So this is what we consider the most, the biggest problem of the standard diffusion training for segmentation, for image segmentation tasks. I have to emphasize that this is only limited image segmentation, but in other cases, with other different noise schedules, we need to study case by case if or not there's any data leakage. And also, I would believe that potentially in nature image, with certain amount of noise, the information loss is way faster compared to segmentation masks. So this is the issue that we found in the standard diffusion model for image segmentations. And so how we propose to solve it? The answer is very simple. You should not use data ground truth as your input. So what you do is you do an additional forward pass. you take a fully noise image or just a noise. You take the noise and take the image and give them to the network to do a first prediction. It's like vanilla segmentation forward pass. It's just at this time you add one more noise on top of it, which is contains zero information. Once you have this first prediction, then based on this, you generate a noise prediction. Then you give them for the network for training. So the backward, the gradient descent backward path only flows until this point. It doesn't, we have a stop gradient here, so it doesn't go through further. So this is what we propose, and we call them recycling. It's kind of like you recycled the model's first prediction. And so this is the method we proposed in this work. So, and this is the method we proposed in the MELBA paper. And earlier in the previous MICAI paper, we proposed something similar, but what we did is derive a noise mask from ground truth. So it partially resolves the problem, but it doesn't really, it still contains sort of ground truth information, but not a lot. So there is this process, and this is our current process where you have the ground truth mask, you noise them completely. So yes, there is an arrow bit from the ground truth to this noise mask, but because of the math, because we add a lot of noise, so the information here is zero. We can consider them as zero. And then we give this to the model, we stop the gradient, we get the predicted mask, then we generate a noise mask, which we go through the training. So all this question mark here is just to say that the noise mask here has no information about the ground truth. And this is what we propose, and the inference is the same as before. So something important in the next slide, you will see that our method, it does not modify the inference part. It's like the inference is the same as the standard. The model always take one mask and one image and take them and put them together to predict the mask. So this is our method. And so we not only compared our method with other with the standard diffusion training, we also compared this so-called self-conditioning method, where there are two different versions. One version is proposed for image processing in computer vision. If another version from Watson, they were proposed for in protein structure tasks. So they are from different domains. But all in all, what they do is they take the ground truth masks, they noise them a little bit, then they feed them to the model to do a prediction of the mask. Then they put this noise mask and the predict mask together to the models. So in our opinion, the data leakage wasn't solved. It's just they provide, in addition, the prediction of a prediction of the mask. And compared this self-conditioning to our method, we all require one more forward step. And also more importantly, because you now take two masks as input, and therefore the inference method is modified a little bit, because now you take two masks, two noise version. But no, you take one noise version and then you also take one prediction as input. So this is so-called self-conditioning. And also for simplicity, the image is always given to the model, but it's not illustrated here on the slides. So that was the method. So how do we check what we describe? It's working, right? So in this work, we checked 4 different data sets. And the information are here, and they are all relatively a considerable size data set. And more importantly, they covered different modality, and also they covered different sizes. There are 2D images, there are 3D images, and there are ultrasound, CT, MR. And then what about the architecture? For the sake of simplicity, we also limited ourselves to the standard unit with one little transformer at the bottom of unit. And we didn't use any diffusion specific module on top of the unit. And we really want to understand is like, if you use the same data same architecture, can diffusion model do something differently? And also, in this scenario, can our proposed method improve the standard diffusion model training? So in short, did our recycling work? Yes, it works quite well. So there are 5 different rows. So this this bold line is our proposed method. This is the method proposed in MELBA, and the line above is the method proposed in Mikai, and another 2 lines are self-conditioned method, and the top row is the standard diffusion. So from what we can see is there is a significant improvement in terms of performance. And worth noting that we have tried the training is the same, but during inference, you have different options to do DDPM or DDIM. For the consideration of the time, I will not go into detail what are the different sampling methods. But what we can see is that the observation is consistent across different sampling methods, and the improvement is quite considerable. And more importantly, is like, because diffusion, denoising is a process, right? It's not one forward step. You do this multiple steps. So at the inference time, we do 5 steps. And at the inference time, what we can see is that, for instance, on the muscle ultrasound data set, the green solid line is our proposed method. From what we can see is that at the first step, the model is at slightly above 87 dice score. And through everything, after every single step, the dice score is improving. It means that the model is somehow correcting their prediction and to produce a better segmentation mask. So this is observed in muscle ultrasound data set. But when it comes to prostate MR data set, we did not observe this improvement. However, we still see that after multiple steps, the performance is the same. It does not drop. But for all the other methods, what we can see is that they have this tendency of, they have this instability tendency, or the performance tend to drop. And our assumption of this observation is because of the inconsistency between the training and the inference step. Is like during training, you sometimes get a fully noised mask as input. And during inference, the first step is also like this. That's why as a first step, you can do not too bad. But then when you start in more and more steps, your input is based on a noise prediction. Then this distribution is different when you have data leakage. It's different from the training input distribution. This shift of the input distribution kind of could potentially explain why when you do more inference steps, the performance dropped. So this is something we think is very important to highlight, but again, it's really limited to this image segmentation task under this noising scheduling. So this is how we evaluate that's our recycling work. And also there's some visualization on the muscle ultrasound. And so the ground truth is here. And what we can see is that our proposed method in this case, it is able to slightly refine them. And also I believe this is compared to other data sets for ultrasound image, the image is relatively more noisy. That could also explain why the improvement is more significant on this data set. And from other methods, and we can see that they are not really able to refine them, or they remain not accurate as a prediction. So earlier we kind of discussed, does our method work? Then the question is like, okay, it's a generative models, right? It generates different segmentation masks. So what are the variation here? Is like when I generate different masks, do I really generate a lot of different things? So in our case, we actually found that for the muscle ultrasound, the difference is relatively large. And here we may want to check the Hausdorff distance. It's kind of more amplified measurement because it's kind of sensitive. So on the ultrasound as a first step, we have this, the standard deviation is roughly 10 pixels. And note the image is roughly 400 times 500. So it's quite considerable as a noise. But what we see that when we do more and more inference steps, this standard deviation between the masks, they are dropping, which means that, yes, at the first step, I do generate different segmentation masks, but with more and more steps, the model kind of converge to something. So this is very, let's say, this is very obvious for the muscle ultrasound data set. For other data set, we more or less, we can say there is this reducing variation tendency, but due to the very limited value scale here, we tend to not draw a lot of conclusions, especially in, this dice here is really 0.00 something, and the difference is really ignorable. So, but this is some interesting finding that we would like to share, is that at least in our experience, there was some variation, but it wasn't really, at some point it converged. It doesn't really keep the variation after multiple steps. So this is some of our findings. And therefore, what are the future work we can do is that, because earlier we said there wasn't really a lot of variation in our case, because the data set we used for every single image, there was only one single label. So by training, by design, it was like this. Per image, I only see one label. So there are other data sets like this. There are other data sets and also other methods, probabilistic unit, etc. They are designed to consider this variation. And this is something we didn't do in our work, but we would like to share this thoughts here. And we believe this is one of the potential future work that we can really work on to study whether or not diffusion model for segmentation can also be applied in this scenario to understand this ambiguous image segmentation task. And also earlier we mentioned UNet, right? So UNet, supervised UNet, is really the standard. So if we do the same thing using the same architecture, using the same training schedule, do we really get the same thing or better? So in our case, if we do not, so the results showing here is the first line per data set is standard UNet. The second line is our proposed method. And our conclusion is that now the proposed method works roughly the same as standard UNet. However, we have additional computation resource cost. But if we don't use our recycling method, then we observe standard UNet is performing better in our setting. This is something has been reported in some work, but also in other work, they claim the diffusion model to work better. But in our opinion, we would like to frankly share this observation to say that we didn't really, using standard diffusion models, we didn't really see a benefit of using them for image segmentation tasks. But we may have some thoughts how to improve them. So first is, in our case, we use the noise, right? We use the Gaussian noise in the very brutal way to add them, to mix them with categorical information. And recently there is this Berit who proposed a Bernoulli diffusion models for image segmentation. This is something we can try, and we can see whether or not there is still data leakage, which I believe very likely yes. So if we can combine this and our proposed recycling method, maybe we can achieve better performance. Or there's another easy way. You just do the noising, denoising thing in the latent space. Then here is whether or not there is a ground truth data leakage, it will be less pronounced. Then second point is regarding network architecture. In our study, we limit to exactly the same architecture just by adding more channels as input. But because noise are relatively high frequency, if you do not do a specific module to process this high frequency noise, then maybe this is something we also need to study, and to how to leverage noise and image, which are quite different to modality as input. Then another thing is some drawback of the recycling is that we need to do one more forward step, right? This is, although we don't flow the gradient back then, but still it's additional cost. But in my opinion, this is not a big deal, because nowadays there are many works. They use our model distillation, they use mean teacher. people anyway maintain two different networks. They anyway do two different forward paths. So the recycling method can be combined with them together just to leverage anyway the work that has to be done. And also there's some sort of about because recycling needs some, all we want is some segmentation mask that does not rely on the ground truth. So if we have any pre-existing segmentation work, it can also be studying like I have a segmentation work trained supervisedly, then can I add diffusion model on top of that? And can I combine them together? So these are different sorts of future work that we would like to propose here, and we can definitely discuss further if anyone is interested offline for collaboration. So all in all, this talk, what we are doing, we are talking about image segmentation. And how do we use diffusion models? We denoise a noise mask progressively. So what is the concern? The concern is that there is a data leakage during the standard diffusion model training for the segmentation. So what we do, we ask one more forward path to use models prediction as the ground truth. Does it work? Yes, we show that it outperforms standard diffusion models for the segmentation mask. And also our code is based on JAX, a relatively new framework. The code is available, and we are quite happy that quite a few stars here. And also, what is the catch in this work is recycler needs extra compute. And in our case, we did not surpass the supervised unit. And all the future work we already discussed is latent diffusion, discrete diffusion, etc. And in the end, first I would like to thank my supervisor, Epan and Matt, for their guidance. I would like to thank my co-author, but also very importantly, I would like to thank all the reviewers and editors from MELBA, but also want to thank the reviewers and editors from the MICAI. And these are the funding, and this is my email and the contact if anyone is interested in. Thank you very much.
Thank you, Yunguang. That was a very clear talk. I really appreciate all the work. It's amazing. I just want to spend maybe a few minutes only if there are any questions about this specific work, and then we can open up to a broader discussion with all the authors. Anyone who wants to jump in and ask a question about this particular presentation? I had one question, and this could be something you talked about. I might have missed it. Sorry. This recycling idea essentially is trying to align the inference and training, right? And basically, what you're doing is you're reusing that model that you're training to go from a pure noise to some sort of label image or corrupted label image that's going to be used. So in my mind, that's almost like the problem that you're trying to figure out is during training, if you're not careful, your model won't be able to go from really, really noisy images. Like, won't be able to utilize really, really noisy images, right? It won't learn it if you just start with noise corrupted images. Right?
Maybe something to clarify. It's a segmentation, so all this noise is happening.
Yeah, noise corrupted labels.
Mask. So the image is always there. So
that's I want to push back on that. It depends on the amount of noise and the type of noise, right? Like at the end of the day, you could imagine that you could be very aggressive during training with noise corruption in a way that would really remove most, if not all, of the label information. I mean, that's what you're trying to get at, right? And so, and the reason I'm really emphasizing this point is in the way you recycle, the model is really not learning to go from a very noisy image to a less noisy image, right? Like because you're not doing any backprop there. The model's always learning from little noisy to less noisy, not super noisy to less noisy, if that makes any sense.
Oh, sorry. Maybe this is something to clarify. It's just for the sake of visualization. From what you see here, it's not less noisy. But the training here, the time point here is uniformly sampled everywhere. So during training, this one can be fully noise.
I guess that's what's going to be my question. Maybe the problem is uniform sampling of the time. And so if you sort of emphasize later time points initially, right? And is that something you guys thought about?
I think there are quite a few different works on that. But the point is really application specific or maybe image specific, at which point you consider the noise is
enough.
Is enough. It's relatively hard to say, here this image, I want 20% information left. This is something, at least from a Gaussian point of view, it's relatively hard. But in my opinion, that's why I mentioned the bird diff, because if you can say, I take all the boundary, I resample all the boundaries, then all this boundary information are gone, then I would consider the disruption of the noise is relatively hard. So, and also in the bird diff, they have this, they can sample how many things you flip the labels, because if you flip the labels, then you know for sure the information are wrong, right? So you can control that more. But I totally agree that there are different ways. By weighing the different time points differently could also be another way to do. But it's just in this work we find it's a little bit hard to tune how exactly you want to do it, right?
Okay, sounds good. There's one question that was typed up. Can you elaborate on what data leakage? Explain a little bit more.
Yeah. So maybe we can focus on this blue background, light blue background image here. Is like, for the standard, the baseline that we consider is that for the train, you take the ground truth mask, then you apply some noise, then you will get this noised ground truth. So this image, this segmentation mask is given together with the image into the network in order to predict the ground truth. So your goal is to predict the ground truth, but your input somehow, from a human visualization point of view, your input somehow highly similar to the ground truth. So this is what I call it data leakage. It's like the target is given because the input is a noise target. When the noise is not enough, the amount of information there is quite significant, especially for segmentation. But when it comes to image, it may be a different story, right? But for segmentation, in especially multi-class segmentation, this is quite obvious here from visualization point of view to see there's something wrong. And you only lose the sense of these shapes when you have a very high level of noising. I hope this answers helps to clarify the question, what is the data leakage here?
Yeah, thank you so much. So you're saying the amount of, let's say in the case of images and not segmentation, that was not a concern. But here is a concern that there's too much, let's say, info visible here. So the network is not learning anything. Huh? That's the concern.
The network may be learning, right? Because the image is always there, but the network will maybe find a shortcut.
I see. Okay, thank you.
We have another question written up by Andrew. Yunguang, if you want to read that out.
Yeah, so this is for me, this is a kind of similar question that earlier you asked. Is like, yes, we can do that. There are also different. There are some works on that last year. But the question is, how do you decide at which level it's good? Because we kind of, when we visualize different things and when we do different data sets, it may be data set specific. And our work here is really to point out, for me, the most important thing of this work is not really, on one side, yes, there's this method, but more important is to point out to people like, because of the way diffusion training is constructed, we need to be careful to see there is potentially this risk here. For me, this is the most important thing. We need to be mindful if there's any potential risk. But yes, indeed, if we just cut to say you always put highest level of noise, this maybe work for segmentation because the image is always there. But I'm not very certain this will be work for other applications where you don't have this image, where you still need some sort of a noising process, and you need the low noising input to facilitate the model training. It's a little bit like those not hierarchical training, but it's more or less like those, you train the model from something simple, then you task the model to train something harder.
Curriculum training.
Yeah, well, yeah, thank you.
Okay, I know there's like another question or two on the chat, but I want to make sure that we have time for our discussion, panel discussion. So if you were an author who presented, could you turn on your camera so that we can see you, and you stop sharing, perfect. And I'm going to let Alan actually lead this discussion phase. I'll be here as much as I can. I might have to jump off for another meeting, but we only have 6 minutes in our scheduled time, but maybe we can go a little over, and if folks need to leave, that's fine. But I'd like to really have people engage and ask any question you might have, or just, this is a place where we can have an open-ended, informal conversation about all this stuff. Okay, so Alan, maybe you can take it over.
Sure. Yeah. Thanks for all the speakers. It was a very interesting talks. First, I guess I'll open it up to people who have any general questions that they would like to ask the speakers. Otherwise, I'm also happy to start off the conversation. But first, I'd like to open up if there's anybody who has anything they want to ask first. Yeah, so maybe one thing that I could start off with is asking each of the authors, asking each of the speakers, was there any, today we heard about VAEs, neural fields, and also diffusion models for generative modeling. Are there sort of some bag of tricks or specific, engineering related tricks for each of these sorts of models that you could share with us that might help the people in the audience to train their own versions of these models? And it would be nice to hear from each of you. Maybe we could go in like the reverse order of how people presented. So first with Yunjie.
Oh, sure. I recently, I have quite a few different things I would like to share. So first is what I already mentioned, when you do diffusion, try to predict the data, not the noise. Then also, diffusion is still all this noise, all this scheduler thing is quite complicated. You may want to check, you may want to visualize your, for me, the most important thing, you need to visualize your input and output to see if it is making sense for the model. And also, recently I think something is when we do this, this really for image segmentation thing, the image resolution is also very important. Recently, a unit group have published a paper where they kind of find that when you compare different models, you say model A is better than model B, but are they really comparing models on the same image of same resolution? And when the image resolution is high, the spacing is smaller, then overall, the model is doing better. Then we just need to be careful when you do comparison. Are you really comparing apple to apple, right? Yeah, so these are some of my thoughts.
Thank you. Imran?
Yeah, I guess my general advice might be just use a UNet for everything. Yeah, that's like, I guess when you're using a VAE or GAN or something like that. Well, I guess GAN not, but like there's always, it kind of has the flavor of a UNet in there. So I'm kind of curious, like where things are going to go after that, or if there's any more interesting models down the line, and like whether we can move away from like grid-based. That's quite interesting to me as well. Yeah, I guess diffusion models are also a lot easier to train as well than something like a GAN. And VAEs tend to, when I played around with them, gave kind of blurry results, probably because I was doing something wrong, but I think that's also something people tend to see. So yeah, it's like, I guess VAEs have really nice like theoretical properties as well, whereas GANs you kind of yeah, like
so just to follow up on that, am I to understand that the training these diffusion models are similar to how you would train a UNet?
Yeah, I would say so. Except you just need a sort of interesting, how you add this noise is quite important, and as was mentioned previously, like it's really important you get that noise correct as well.
Yunjie? I think Ravi had to drop out, so Yunjie.
So maybe some advices from me about training a nerve model is, I just found that the sampling methods can influence the performance a lot. Like what the nice thing about the nerve model is the training sample can be, well, it's points, so it's pixels, voxels, points, so it can be independent to the resolution. So like for the training, you sample the points from arbitrary resolution to train the model, and how you sample the points is very important to the performance. Like you can you can sample more points during from the contours, and you can have a better reconstruction of the shape. So yeah, that's one advice for training to train the nerve model. Yeah.
Thank you. Is there any other questions? Any other general questions?
Did you have any problems with like initialization of your nerfs, or like I always get a bit worried about like, is there any principled initialization method for
Oh
nerfs?
yes,
Or
there are a specific nerve model called Siren. It needs special initialization, but the rest of them I didn't see any significant difference between different initialization.
And what activation functions did you use in the end?
I use sign function. I use Siren model.
But was that in the activations inside, or just the start?
Yeah, just sign function.
Okay. Yeah. Thanks.
I guess another thing, this question is purposefully broad, but at what point in your sort of ideation to try to solve these problems do you think generative modeling is a good idea? So what are some general sort of principles or things that you find that, okay, this type of problem probably would benefit from a generative modeling strategy, and when does it not benefit a generally modeling strategy? Are there any sort of universal or principles that you can sort of distill for us and share with us? Open to anyone.
Maybe I can quickly answer something. So I think first generative model it means that there are some variations, right? So we first need to understand where this variation exists. If there's no variation, then why we need a generative model? If there's nature noise, like in the previous talks, the measurements, they are from physics, they are noise naturally there, then it makes a lot of sense in the sense of inverse problem. You need to somehow denoising things. And in segmentation, it's less, even segmentation of nature images, I feel like it's something interesting to study, but the ground truth is quite certain why you need to be generative and creative here, right? So that's my main thoughts.
Any other questions, comments?
Yeah, I guess for using it in reconstruction, it was really nice to separate out the forward model from your image model, which was quite interesting. And it's kind of like when you look at the prior gradient or your gradient of your log density, it kind of looks like something what should be a prior. So it's quite natural to then try and integrate it into reconstruction, which is quite nice. Yeah. But I guess on the other hand, like I've seen some like using like VAEs or GANs, and then you can put your generator directly into your problem, but then you're always restricted to the range space of that generator, which might not be good because you don't know if it'll create the right image or not. So it's kind of nice. Yeah. Yes.
Sotos, I think you raised your hand.
I wanted to have a bit of, hi Alan, thanks for stating this. I wanted to have a bit of more philosophical discussion about, in general, diffusion models, or in general, generative models, or whatever the next one will be, and what sort of separates us as a community from the computer vision field, right? So what sort of challenges we see that are not being tackled within scaling up, let's say, generative models that we should be tackling and moving forward. Any volunteers to start?
Maybe sorry, because I really feel I have a lot of thoughts on this question, because in medical imaging, we are handling 3D or even 4D data. And in my study, most of the time, the biggest problem is like, there are many nice tricks here and there in computer vision. They handle 224 times 224. And in our case, we have to handle a way larger image. And actually, they are not relatively, sometimes the image is huge, but the information are not everywhere uniformly distributed, right? So in my opinion, how we can take care of 3D, 4D, these high dimension data and a high volume, and how we can resolve that in able to train things. On one side, we have large images. On the other side, we have little amount of image most of the time compared to computer vision, and how we can schedule sort this scalability problem. That is something I personally would be very interested in, but I think it's also, as a community, we kind of need to sort it. And linking about this is potentially also the reason why UNet is so good, because of the efficiency of the network. So UNet has been proposed for more than a decade now. It's like, I'm not sure, more than a decade. It has been proposed many years now. And what is the next? I understand there is a lot of VIT around, but I think in my cases, it sometimes works, it sometimes doesn't work. UNet remains the best thing to use, but what is the next one?
Thank you, Yunquan. I mean, you were just ready to say that UNet is already old, right? So imagine how I feel with the white hair here. So I just can I challenge you a little bit on this? So is it about? So I understand that we have to probably make architectural changes, correct? Right? But is it only architectural changes, or it's also that we have to think about a different data scale in order to really leverage? Like if we think about what OpenAI has done with the video, with the video generative models, right? So think about what the engineering that has gone behind, not only on the dataset side, but and the architecture side, but the engineering. Is there something that we as a community should do, not only in terms of coming up with like minor architectural changes, but something different? And how can we make this thing happen, right? If we really, I think this is kind of like the right fora to have these discussions, right? So anyway, I wanted to kind of like get your thoughts on this, and everybody else's as well.
Yeah. Maybe I just quickly say something, and to leave the other speakers the floor. So I think for me, it's not about architecture. It's potentially about how we represent the data. The way we are represent those data in pixel, voxel, most of space are zero, and some space are informative, right? And the way we are representing them as a big 3D, 4D tensor, it may not be the best way. It may be not efficient enough. And should we rely on a small network to compress them one way or another, or not? This is something, to answer your question, this is something I think potentially we can think about.
It's funny how we went back to having representations, and we need to have better representations, which is what I do, representation learning. And I always argue that units have no representations, and then I get into these big arguments and fights about where are the representations. Anybody else before, everybody wants to like contribute on that discussion, and then we can have perhaps draw it to a close unless there is a burning question.
Maybe there's been like some like leakage sometimes from like more computer vision stuff back into medical field. Like I guess nerfs might be one instantiation of that, sorry. But like maybe like Gaussian splatting or something like that, which is relatively new, might be a way of getting this really concise representation, which you can learn something over. But that opens up more questions, like
does Gaussian splatting fit medical imaging?
Pardon?
As a prior, does Gaussian splatting fit our domain or not? As a theory, you mean? You think does it fit?
Like the splatting part, definitely not. But the representing something with Gaussian functions, for example, would potentially make sense. Or like it's a similar, I guess, question why to use a nerf as well. It's like you could, yeah. I think there's links between nerfs and Gaussian splatting probably.
Alan, I'll pass it on to you unless there is somebody else that wants to ask a question.
Yes, is there any further questions, comments? If not, looks like we are about 10 minutes over time. And if there's no further questions, maybe I'll start wrapping up. But first of all, I want to thank all of the speakers. Please join me in thanking them again for their time and their great presentations. It was great to hear all of them. I'd like to take this moment to thank Mert and also other members of the MELBA board for hosting. And thanks to the people who helped out with organizing this, including James, Leo, OL. We were kind of who helped to make this a possibility. So thanks to them. And lastly, I want to say that this is all being recorded, so we're going to make this available on the MELBA Symposium website. So feel free to check that out and keep an eye out for that. Okay. If there's nothing else, then thank you again, everyone. Have a good day. Thank you. Thank you.
Thanks.